Hi everyone, a very good day to my fellow PBSM members. A few weeks ago, our president of PBSM, Avinash, had given a talk about what is first aid. Let's have a review about his talk before we enter the new topic. First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. Importance of first aid. A quick response. First aid can save lives. A greater sense of safety. Helps to meet legal safety requirements. There are 4 basic steps to performing emergency first aid. Step 1. Assess the situation. Assess the situation and check for any potential dangers to yourself, bystanders, or the patient. Check for safety for you, bystanders, casualty, and surrounding before taking your next action. Do not give any rescue if the situation is danger. Next, assess the person's conditions. Is the victim suffocating or breathing heavily? In these cases, act immediately and appropriately. Is the person conscious? Is the person breathing normally? Step 2. Plan for interventions. Get help. Call for help or ask someone to call for medical or professional help. Next, plan first aid interventions. Plan what action to take until professional help arrives based on the initial or primary assessment. Determine how much help you can give based on what you know and what skill you have. Ensure your ongoing safety as a rescuer. Step 3. Implement first aid. Implement first aid. Give first aid for life-threatening emergency or specific injuries based on the initial assessment. If emergency services are arriving very soon, don't sprint injuries. Maintain safety and wait for assistance. Give psychological first aid. For example, talk to person and family. Inform them what is happening and what are you doing if it is necessary. Prepare the person for transportation. 4. Evaluate the situation. Evaluate first aid actions. Check that medical or professional assistance will arrive soon. Check that the scene remains safe. If not, consider moving the person as carefully as possible with help from bystanders or other rescuers. Recheck the action after the initial assessment. Hand over the person to medical or professional paramedic when they arrive. Mr. Where will casualty go to receive their treatment? Inform their families or relatives. Our president also talked about method of DR as ABCB. D. Danger. R. Response. S. Send for help. A. Airway. B. Breathing. C. CPR. D. Defibrillation. Also talked about choking last time. Choking occurs when a foreign object lodges in the throat or windpipe of the casualty and blocking the flow of air of it. Choking cut off oxygen to brain, and we have to give first aid as quick as possible to the casualty. Universal sign for choking is hand crossed to the throat. If the person doesn't give the signal, look for this indication. Inability to talk. Difficulty breathing or noisy breathing. Squeaky sounds when trying to breathe. Cough, which may either be weak or forceful. Skin, lips, and nails turning blue or dusky. Skin that is flushed, then turn pale or bluish in color. Loss of consciousness. I'm going to talk about the way to handle choking. If the person is able to cough forcefully, the person should keep coughing. If the person is choking and can't talk, cry, or laugh forcefully, a 5 and 5 approach to delivering first aid. Give 5 back blows. Give 5 abdominal thrusts. Alternate between 5 blows and 5 thrusts until the blockage is dislodged. To perform abdominal thrust on someone else, Step 1. Stand behind the person. Step 2. Make a fist with one hand. Step 3. Grabs the fist with the other hand. Step 4. Perform between 6 and 10 abdominal thrusts until the blockage is dislodged. These are the following ways to perform abdominal thrust on yourself when you are choking. Step 1. Place a fist slightly above your navel. Step 2. Grab your fist with the other hand and bend over a hard surface. A countertop or chair will help. Step 3. Shove your fist inward and outward. Step 4. Position your hand a little bit higher than with a normal abdominal thrust at the base of the breastbone, just above the joining of the lowest ribs. Step 5. Proceed as with the abdominal thrust, pressing hard into the chest with a quick thrust. Step 6. Repeat until the foot or other blockage is dislodged. If the person becomes unconscious, follow the next step. Last we reverse on the topic shock. Shock is a critical condition brought on by the sudden drop in blood flow through the body. Shock may result from trauma, heart stroke, blood loss, an allergic reaction, severe infection, poisoning, severe burns, and other causes. When a person is in shock, his or her organs are not getting enough blood or oxygen. If untreated, this can lead to permanent organ damage or even death. Signs and symptoms of shock include cold, clammy skin, pale or ashen skin, rapid pulse, rapid breathing, nausea or vomiting. If you suspect a person is in shock, call 999 or your local emergency number. Then immediately take the following steps. Step 1. Lay the person down and elevate the legs and feet slightly, unless you think this may cause pain or further injury. Step 2. Keep the person still and don't move him or her unless necessary. Step 3. Begin CPR if the person shows no signs of life, such as no breathing, coughing, or moving. Step 4. Loosen tight clothing and if needed, cover the person with a blanket to prevent chilling. Step 5. Don't let the person eat or drink anything. Step 6. If the person vomits or begins to breathing from the mouth and no spinal injury is suspected, turn him or her onto her side to prevent choking.
Hi guys, I'm Dan Zhang from PBUM. I'm gonna to introduce you all the types of wounds and bleedings. So, what do you know by wound? A wound is a type of injury which happens relatively quickly in which skin is torn, cut, or punctured, which is an open wound, or where blunt force trauma causes a contusion, a closed wound. And these are some of the examples of the types of wounds. There are abrasion, lacerations, incisions, puncture, dog bite, human bite, gritty, and a gunshot. So there are some types of open wounds I'm gonna introduce, which is the incisions. First, incision is caused by the clean, sharp-edged objects such as a knife, a razor, or the glass splinter. And for the lacerations, lacerations is a rough, irregular wound caused by crushing or ripping forces. It is a deep cut or tearing of your skin. Accidents with knives, tools, and machinery are frequent causes of lacerations. In the case of deep lacerations, bleeding can be rapid and extensive. Thirdly, abrasion. It is a superficial wound in which the topmost layers of the skins are scraped off. It is often caused by a sliding fall onto the rough surface. It's just like you fall down onto the road. There's usually not a lot of bleeding, but the wounds needs to be scrubbed and cleaned to avoid infections. Next, puncture wounds. A puncture is a small hole caused by a long pointy object, such as a nail or needle. Sometimes, a bullet can cause a puncture wound also. Punctures may not bleed much, but these wounds can be deep enough to damage internal organs. If you have even a small puncture wound, visit your doctor to get a tetanus shot and prevent infections. Next, penetration wounds. It is caused by an object such as a knife entering the body and creating an open wound. Next, I'm going to talk about avulsion wounds. This is the wound that occurs due to the integrity of any issues is compromised. It's hurt a little bit complicated, right? So the easy way is avulsion usually occurs during violent accidents such as body crushing accidents, explosions, and gunshots. This might cause the patients bleed heavily and rapidly. Now I'm gonna to introduce you all the types of external bleedings. They are divided into three types, which is venous, arterial, capillaries. For the venous bleeding, when it have cuts, dark red blood which flows profusely from the wounds. And for the arterial bleedings, the bright red blood which spurts from wounds. And for the capillary bleedings, there will be dark red or the bright red blood which oozes from the wounds. The difference between them is for the arteries it is pulsating flow, and for the venous bleeding it is steady slow flow, and for the capillaries bleeding it is slow even flow. For severe bleeding, we have to take these first aid steps and reassure the injured person. Firstly, you have to remove any clothing or debris on the wound. You don't remove large or deeply embedded objects, as this may cause more blood loss. You are also not allowed to probe the wounds or attempt to clean it yet. Your first job is to stop the bleeding. And if possible, you have to wear disposable protective gloves. Secondly, you have to stop the bleeding. What do you have to do? You have to place a sterile bandage or clean cloth on the wound and press the bandage firmly with your palm to control bleeding. You can also apply constant pressure until the bleeding stops. Maintain the pressure by binding the wound with a thick bandage or a piece of clean cloth. Don't put direct pressure on an ice injury or embedded. This might make the wound worse. Then, you have to secure the bandage with adhesive tape or continue to maintain pressure with your hands. If possible, you have to raise an injured limb above the level of the heart so that there is less blood loss. Thirdly, you have to help the injured person lie down. If possible, you should place the person on a rug or blanket to prevent loss of body heat. Calmly reassure the injured person. And please take note that you don't remove the gauze and the bandage. If the bleeding seeps through the gauze or other cloth on the wounds, add another bandage on top of it. And you should keep pressing firmly on the area. Fifth, tourniquet. A tourniquet is effective in controlling life-threatening bleeding from a limb. You should apply a tourniquet if you train in how to do so. And when emergency help arrives, explain how long the tourniquet has been in place. 6. Immobilize the injured body parts as much as possible. You should leave the bandages in place and get the injured person to an emergency room as soon as possible. You can call 999 or 112, which is the emergency number of the ambulance, if the bleeding is severe or you suspect the bleeding is internal bleeding, or there is an abdominal or chest wound. or the bleeding can't be stopped after 10 minutes of firm and steady pressure, or the blood spurts out of wound and non-stop. When do you need to call a doctor? The wound is deep or the edges are jagged or gaping open. The wound is on the person's face. The wound has dirt or debris that won't come up. The wound shows signs of infections such as redness, tenderness, or the thick discharge, or if the person runs a fever. The area around the wound feels numb. Red streak from around the wound. The wound is a result of an animal or human bite. The person has a puncture wound or deep cut and hasn't had a tetanus shot in the past 5 years, or anyone who has not had a tetanus shot in the past 10 years.
So, hi guys, I'm Pavitran from PBUKM. So, the topic is strains and sprains. Okay, so first of all, you guys will think that strain and sprains are same. Actually, they are not the same, they are totally different. Okay, because maybe they might have the same type of symptoms and signs, but they are not same. So, let us see what's the difference between strains and sprains and where they will occur actually. So, let us go to the next slide. Okay, so what is strain? So a strain is an overstretched, torn or twisted tendon or muscle. A tendon is a tough cord of fibrous tissue that connects muscles to bones. Commonly strained area include the legs, knees, feet and back. So this is the definition of the strain. So you guys can just go through it again. So I give about 20 seconds. Okay, so now we go for the symptoms and the signs. This is the symptoms and sign for the sprain. Okay, so first of all, a strain can occur suddenly, but it may develop over time. So for example, we have swelling, pain, bruising. So bruising is something like blue-black spot on the skin where it occurs on the affected area. So the fourth is cramping, so a cramp in the muscle, and five is the limited movement in the area. So you guys will feel pain, right? Of course you guys will feel pain, so you guys can't move that much in the affected area. So yeah, so these are the symptoms of the strain. So now sprain. So what is sprain? So a sprain is an overstretched, torn or twisted ligament. A ligament is no band or fibrous tissue that connects bone to other bones or cartilage. Ligaments are usually located around joints. Commonly sprained areas include the wrist, ankle, thumbs and knees. So these are the definition of sprain. So I give about 20 seconds again, so you guys can just go through it. Okay, so next. So these are the signs and symptoms of sprains that occurs on the affected area. So first is swelling. Second, of course, there's a pain. And third is bruise, which is bruising. Fourth is limited ability to move affected joint. And five is hearing or feeling a pop in your joint at time of injury. So maybe the symptoms of sprain and sprains are slightly same, are partially same, but they occurs in different areas. Okay. How to treat the sprain and strain? Okay, so it's easy. We say as RICE. So what is RICE? So R stand for rest, I stand for ice, and C for compression, and E for elevate. So rest. If you guys feel pain or a pop sound in the affected area, so please stop doing exercise or physical activities immediately. Okay, doing physical activities with the pain, it may cause another problem or sometimes fracture or severe injury. Okay, so next is ice. So please apply ice to the affected area up to 20 minutes every 2 to 3 hours. So I definitely that ice something like painkiller, so it may reduce your pain and also your swell. Okay, so next is compression. So why we need compression? Compression is to help reduce swelling. Example, wrap the affected area with the bandage, and make sure when you're wrapping the affected area with the bandage is not too tight. Okay, if it's too tight and there will be less blood circulation and it may cause another problem. So please be professional in doing all this type of work. And last is elevate. In my opinion, I think so maybe you guys think that this is an easy way to overcome this problem. Yes, it's easy, it's look easy. Okay, it seems like easy, but if you guys doesn't do it well, it may cause another problem and maybe um, severe injury or something like that. So please be careful in doing all this work. If you're not sure with it, please get others advice so you guys will get the clarity to do it in a well manner. Okay, so next. Okay, when to see the doctor? Mild sprains can be treated at home, but the injuries that cause sprains can also cause serious injuries, such as fractures. You should see a doctor if you, okay, if you guys feel like too painful, can't move your leg, okay, so please go to the hospital or any medical center, get the treatment as soon as possible. Okay, don't drink any painkillers, okay, if you're not sure with it. Please go and get treatment or meet the doctor. Please consult with your doctor so that you can overcome your problem easily. Okay, first, because sometimes you have to know that sprains can also cause fractures. Okay, so you must be very careful with it. So first, what are the causes of fractures? Okay, can't move or bear weight on the affected joint. Second, have pain directly over the bones of an injured joint. And third, have numbness in any part of injured area. And fourth, fever or chills. Okay, you guys will feel fever suddenly. And fifth is difficulty walking or standing without pain. So let us see where's the causes actually. Sprain and strain occurs. So it always occurs in ankle, knee, wrist, or thumb. So let me explain some situation and you guys can capture the situation easily. Okay, so ankle pain always can occur while we are doing jumping jacks or when we fell down in a deep places in a, like for example like drain. So the twist in the ankle can cause sprain and strain. Okay, next is knee pain. For example, like athletes, they are doing sprinters without their stretching, so it may cause knee pain. Third is wrist pain. Wrist pain and thumb pain is almost the same, so it always occurs while they are playing badminton, tennis, squash. Okay, this type of games may cause wrist pain or thumb pain. The impact from the ball or the impact they're giving to the ball may cause wrist pain or thumb pain. So now is risk factors. So the factors contributing to sprain include, okay, first is environmental condition. Okay, sometimes slippery or uneven surface can make you more prone to injury. Okay, for example, like I said, twist in the ankle. Okay, all because of these environmental conditions. Okay, second is fatigue. Tired muscles are less likely to provide good support for your joints. When you're tired, you're also more likely to succumb to force that could stress a joint. Okay, and finally is poor equipment. Okay, the triple I fitting or poorly maintained footwear or other sporting equipment can contribute to your risk of a sprain. Okay, for example, while you guys are going to gym, you guys must use a good sport shoe. Okay, a comfortable sport shoe, and you guys must use fitness sport shoe, not badminton sport shoe or golf sport shoe. Okay, because when you guys are using that, it may cause instability in your skeleton, and it might cause twist. It might cause twist in your ankle or in your knee. So you must be very particular in these things. Okay, so you guys must be very careful while doing activities. Okay, how to prevent sprain and strain. Okay, people can help to prevent sprain and strains by first stretching muscles around joints. Okay, regular conditioning and stability exercise can build a strong skeletal framework and help prevent injuries. So as I said, please do stretching before doing exercise. Okay, please warm up your muscles. Please warm up. Okay, please inhale oxygen and exhale your carbon dioxide. Second is warm up properly before exercise. So warming up the exercise muscles increase the range of movement and helps to avoid trauma and tears to connective tissue. Third is wear appropriate footwear. Shoes with proper support can help to protect the ankle and knee joints. And fourth is be aware of your environment. Watching out for slippery or uneven surfaces or obstacles that may cause an accident can help prevent injuries. And last but not the least is take breaks. Sitting or standing in one position for too long or performing repetitive actions can put undue strain on the muscles. People can take regular breaks and stretch to release the muscles. Okay, if you guys are doing exercise, so you guys really need rest or break. Okay, you guys must take a break. Not doing exercise continuously. Okay, maybe it might not cause pain or strain, but at last it may cause dizziness. Some people may cause heart attack because they loss of oxygen. Okay, so we must be really careful in doing exercise. We must really take breaks. Okay, drink water continuously. So now here we have a video from St. John Ambulance. So they're going to teach how to treat sprain and strains in affected area. So let us see the video.
If someone sprained an ankle, knee or elbow, you can use a bandage to support the limb. To make sure you give the right kind of support, bend the joint slightly and apply an ice pack and padding, and then a bandage to help cool and support the injury. You need to wrap it either side of the injury too, to give enough support for the whole area. We're going to demonstrate this technique on an ankle, but you could use it for an elbow or a knee. To bandage an ankle, use a roller bandage. Make sure you have the ankle raised and supported to start with, and then apply an ice pack and some padding. Using the roller bandage, start with the tail and put it to the inside of the foot, and then wrap it around 1.5 times just to make sure that it doesn't come off. I'm just going to lift up your leg a little bit. Okay. It's important to bandage from the toes to the knee because you need to make sure that you cover from the joint before to the joint after the injury site, and then just keep on going around and around. So keep on going until you get to the knee. And then if you can, wrap the bandage around twice when you get to the knee, and then just pin it in place. Does that feel okay? Yep. To check circulation, squeeze the toenail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. Keep checking the circulation every 10 minutes because the ankle may still swell. So remember, when you're bandaging a sprain, apply an ice pack and then cover the injury with padding. Apply a roller bandage to hold the ice pack and padding in place and to help support the injury. Check circulation every 10 minutes and keep the injury elevated. And that's how we bandage a sprain.
Hi everyone, I'm Tamashin from PB UKM, who is one of the first aider. Today I will introduce one of the necessary equipment in a first aid kit, which is a triangular bandage. And today we will learn 3 types of bandaging by using the triangular bandage. Okay, first thing, what is triangular bandage? I'm sure that everybody gets to know about triangular bandage, even you are not a PBSM member before in your previous school. But I'm sure that you all know about the triangular bandage. If some of you don't know about the triangular bandage, I will show you in the next slide. So this is the triangular bandage. It is a white color triangle cloth. It has 3 corners, top corner, middle corner and bottom corner. So you can see that in your left hand side. But the middle corner of the triangular bandage has a special name which is called apex. The use of triangular bandage. A triangular bandage is used as an arm sling or as a pad to control bleeding. It may also be used to support or immobilize an injury to a bone or joint or as impressive padding over a painful injury. Before we start to learn the bandaging, we have to learn how to tie a reef knot, which you can say that in Malay is a ikatan hidup. Why we have to learn reef knot before we learn the bandaging is because reef knot is a very important part that will help you to adjust the tie easily and untie it within a second. So it will be very helpful when you are in an emergency situation. Importance of reef knot. The reef knot is the best knot for tying bandage and sling. It lies flat, making it more comfortable than other knots. It doesn't slip. It is easy to untie in order to adjust the bandage like what I just mentioned in the previous slide. So this is the way to tie the reef knot. Take one end of the bandage in each hand. Lay the end from the right hand over one from the left hand and pass it under to form a half knot. This will transfer the ends from one hand to the other. Tighten by pulling one loop against the other or by pulling only on the ends.
You should use a sling to stop someone's arm moving to protect it and prevent further damage. There are 2 types of sling, an arm sling and an elevation sling, and both can be made using a triangular bandage. The difference between these 2 types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. You just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder and the bit that's hanging down, bring that up to beat it. If you just let go of your arm for me now and then re-support it. Lovely. Just tie a reef knot. And then tuck the corners underneath. And make sure the whole of the arm is supported, down to the little finger. With the bit that's left over, just twist it until it becomes nice and tight and it snugly fits in around the elbow. To make an elevation sling, first ask the casualty to support their injured arm. You just support it there for me, and their fingertips should be touching the shoulder. Lay your triangular bandage over the injured arm. Just get the casualty to hold it in place. Just hold it there for me. Come underneath the arm, around the back, and then tie using a reef knot. And then just tuck the points under. With the bit that's left over, just twist it until it's nice and tight and it fits snugly in by the elbow. To check circulation, you need to squeeze the fingernail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the sling is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, there are 2 types of sling. You need to know which one to use for each condition and how to apply them.
The reef knot. Now we learn how to make an arm sling and what is the function of an arm sling. First, to start the arm sling, you have to ask the casualty to support their arm with their own hand. Gently slide the triangular bandage that you have underneath the arm, and the point of the triangle should be underneath the elbow of the injured arm. Means that apex will underneath the elbow of the injured arm. Then bring the top end of the bandage around the back of the neck. So the second step, fold the lower end of the bandage up over the forearm. The forearm is the front part of your arm to meet the top of the bandage at the shoulder of the injury side. After that, you tie the 2 ends of the bandage together in a reef knot that you had learned early above their collarbone and tongue in the free ends. Free ends mean you can adjust easily. After you finish your reef knot at the tongue or the bone, you adjust the sling so that it supports their arm all the way to the end of their little finger. So make sure that your bandage is enough cover until the little finger. So after you adjust your sling, you make sure the edge of the bandage by the elbow is secure by twisting the fabric and is tucking inside, or using a safety pin to fasten. So you have 2 ways to make sure that the bandage is clear and tight. By the first way is you twisting it, or the second way you using the safety pin to fasten it. After you finish your sling, you check the circulation in your fingertip every 10 minutes. How to check the circulation? You press the nail for 5 seconds until it turns pale, and then you release it. You see that the color will return within 2 seconds. If the color will return, it makes sense that the circulation is keep going on toward the person. So after we finish the arm sling, now we will see the evaluation sling. So the evaluation sling is something quite similar with arm sling, but we will go through that after, and then you will see that we will using the same thing, which is the reef knot again and the triangular bandage. So the first thing as usual, you have to ask the casualty to support their injured arm across the chest with their finger resting on the opposite shoulder. So this one, the casualty position will different with the arm sling. You can see that there are different of position for the casualty. After the casualty support their arm, you lay the triangular bandage over their chest on top of the injured arm with one end over the uninjured shoulder, and hold the point of the bandage just below the elbow of the injury side. So you have to highlight that the bandage is just below the elbow on the injured side. Okay, after you lay the triangular bandage, you tie the lower part of your bandage underneath the injured arm. and then you bring it diagonally across their back to meet the other end of the bandage at their shoulder. After all that, you lay down the triangular bandage and then you find the position of your triangular bandage. As usual, you tie the two ends of the bandage together in a reef knot. And also at the same position is the collarbone and tongues in the free end. This step is same with the arm sling that you can see. After you tie your reef knot, you have to make sure that the edge of the bandage by the elbow is secure by twisting the fabric and tucking it or using a safety pin to fasten it. This step is to make sure that your sling look tiny and clean. So this is the last step that you can see that even though it's the arm sling or the evolution sling, this step is very important. You have to check the circulation in your thumb every 10 minutes. If the sling is too tight, you have to loosen it or you have to readjust your sling. So lastly, ring pad and donut bandage will be the last bandage that we have to learn today. So the use of ring pad. The ring pad is used to put pressure around the impaled object without putting pressure on the object itself.
Impaled objects. Bandaging technique: donut or ring pad. Fold the triangular bandage in a threefold cravat. Make a loop at the center of the triangular bandage. Grab the first end, wrap it around the loop. Tuck the tip. Wrap the other end around the ring pad. Keep on pulling before wrapping around. Tuck the loose ends.
Remember to snap the picture of your ring pad and attach the picture to the Google form. Each of you guys must submit your photo as evidence or proof for our online activities. The attendance are not being counted if the pictures are not attached to the form. I repeat, please practice the bandage skill they had taught by Thomasin just now, with the triangular bandage given. You are given about 25 to 30 minutes for the ring pad. Remember to snap the photo of your ring pad and attach the picture to the Google form.
my hand and hold it tight. Look at the paintings, I'll be your guide. Don't stop looking in my eyes. Are you cold? Do you want to sit down? I've been here a million times, so I know my way around. Don't stop looking at me now. I know you don't care as much as I do, but I'm just content with me next to you. Let's go to an art museum, I'll explain it at the coffee shop. I know you don't get it, but there's no need to fret it. It's like a gift, it's about the thought. Monet might be too much and Van Gogh might take a while, but thank you for coming. I know that you're trying to do anything to make me smile. I'll have a cup of tea while you have a latte for both you and me. The caffeine will make sure that you don't fall asleep, 'cause darling, you're sleepy, eyes are closing. Please stay awake for me. I know you wanna go, but please stay here with me. I could show you things that you've never seen. Let's go to an art museum, I'll explain it at the coffee shop. I know you don't get it, but there's no need to fret it. It's like a gift, it's about the thought. Monet might be too much and Van Gogh might take a while, but thank you for coming. I know that you're trying to do anything to make me Let's go to an art museum, I'll explain it at the coffee shop. I know you don't get it, but there's no need to fret it. It's like a gift, it's about the thought. Monet might be too much and Van Gogh might take a while, but thank you for coming and thank you for trying to do anything to make me smile.
I don't want your love. Don't come to me now. I don't want your love. Don't come to me now. I don't want your love. Don't come to me now. I don't want days are long.
Please scan the QR code which will be given at the end of the video for taking the attendance. The attendance are compulsory. I repeat, please scan the QR code which will be given at the end of the video for taking the attendance. The attendance are compulsory.
2,000 years later.